So here we are. So for those of you who are just joining us, I'm going to do my best to keep tabs on if you have questions or things you'd like us to talk about. So some of you may know Dr. Peter Eckman, who I have had the privilege of knowing for many, many years. And some of you may not. And one of the main things that I know of you, I also ran the bookstore there at Thai Sophia for many years. And In the Footsteps of the Yellow Emperor was one of the earliest books, long before I was an acupuncturist, that I really read and helped me understand some things about, about what I thought my parents were doing, what their work was. There you go. So for those of you who haven't seen it, and if it was backwards, it's In the Footsteps of the Yellow Emperor. Singing Dragon Press, is that right?
No, this was the first book I wrote. My last two were Singing Dragon. This is Long River Press.
Long River Press. So if you're looking for it, that's where you can find it. So,
or you can go to my website and get it. I may have the last remaining copies, so
okay.
If you can't find it elsewhere, contact me.
I'll post a link then in the chat to your website as well. So Peter, will you tell us a little bit about just who you are, what your background is, or what had you agree to talk with me today here in front of our people?
Sure. I'd actually like to start off with a little nod to our ancestors, and particularly your ancestors. Your mom and dad, Diane and Bob, were very, very influential in my life and my professional career. And I really want to express my gratitude to both of them. I taught a class at MUIH about, 2-3 years ago now, and had a really nice dinner with your mom, whom I remember very fondly from my days in England at the Worsley School. And then very specially, I want to express my gratitude towards your late father, Bob, who was so important in supporting me in moving from just being a practitioner who was curious about things to someone who had things to share with the profession, both as a speaker, but more importantly, as a writer. I didn't envision myself as a writer to start with. And after I had gotten into that, and I think it was after I had published Footsteps, Bob approached me and offered a substantial advance of money for me to write a textbook of 5-element acupuncture, which was a project we worked on together at the beginning, until I realized it was beyond my ability to do that and everything else I was doing. But I always felt that Bob was right there with his hand on my shoulder, giving me the support I needed to go whichever direction I wanted to go in. And I just want to say thank you to wherever he is now. That, I don't think I'd be the same person without having met him and known him and benefited from his work.
Wow.
Yeah. So for the people that don't know me.
So we're going to start this off with me in tears, are we?
Yeah, why not? Why not? Tears
Thank you.
Are good.
Well, and you know what? I didn't know quite the level of influence he had on you and your work. So I am deeply grateful then for his, pushiness, or whatever you might have called it sometimes when he was wanting you to saying, okay, move out into it. But I'm really grateful because so many practitioners have gotten the benefit of you being willing to do that. And so I'm really glad. Thank you for taking him up on it.
No, my pleasure. So in terms of your original question, my initial training was, how do you stay out of being a soldier in the Vietnam War? Which for me meant staying in school as long as you could, because you could get a draft deferment. And the longest that I could think of to stay in school was to go to medical school. And on top of that, to also get a PhD at the same time. So I could drag that out to 7 years of postgraduate education without having to worry about being forced to go kill somebody that I had no animus towards. So that
That's
was
fascinating.
yeah, that's how I got into medicine. You know, I suppose I had an interest in biology and medicine to start with, but it wasn't from a strong place of saying I'm going to be a doctor when I grow up. I just found it to be a convenient slot to go into at the time in my life that that occurred.
Huh.
And so what I ended up doing was going to New York University Medical School and simultaneously getting a PhD at New York University in physiology. So that whole process took 7 years, and it allowed me a lot of time to be free of the worry of military service, but also to think about what those different kinds of career options were about. What is it like to be a doctor? What is it like to be a research scientist? And surprise, surprise, when it came the end of that, well, for one thing, to be able to actualize the medical part of that, legally, you need to have at least 1 year of medical internship before you can get a license to practice. So I did do a medical internship and moved from New York, where I trained, to San Francisco, California, where I did my internship. But I realized that in that year of internship, uh, I got the real inside view of what it's like to be a doctor and what it's like to be part of that kind of institutional training mechanism that we have for doctors in this country. And I have to tell you, I did not like it one bit.
You're not the first doctor I've met who had got all the way to that edge and went, I don't know that this is what I want to do.
Oh, I was past that. I knew it was what I didn't want
I
to
knew this is not what I want to
do.
do.
Yeah, yeah, I was thinking seriously about becoming a cab driver, actually.
Wow. What was the part that kind of had you say, not like, I can't do this particularly? Because it's,
Yeah, it's a
yeah.
good question. Yeah, for me, the worst part of it all was the hierarchical nature of medical training, that the people at the top dumped on the people below them, who dumped on the people below them, who dumped on the people below them, all the way down from the attending physician to the residents, to the interns, to the medical students, and basically uh, had no concern for their feelings. It was just go do this and don't even give me any trouble about it. This is your job. And I just had no sense that that was a fulfilling way to lead one's life. And if you came out of that training, most likely you were going to start adopting that towards your patients. You know, it was going to be, I'm the authority who knows everything, and I'm going to tell you what to do, rather than, well, you know, I have some training and some knowledge that I'd be happy to share with you, and then let's talk about it and see where we go from here, which is the way I intuitively experience the right way to practice medicine.
Mm.
Interesting, my dad was a dentist, and I grew up with the dental chair in our living room. And so I always had patients in my house, in my apartment in the Bronx, as
Oh,
part of my
wow.
life.
That's fascinating.
Yeah, yeah. And I think that really set me up for the sense that the practice of medicine is a very interpersonal, communal experience that isn't exemplified by the real high-tech hospital environment that was what I trained in when I eventually became a doctor.
Mm.
And that I really preferred the former much more than the latter.
It's
So
so,
I ended up just deciding that I was not going to sign up for a residency. The war was over, I think, or at least I was past the point at which I was draft eligible. And so I just took some time off. I'd been in school forever, you know, 9 years after college. 7 years after college, and I hadn't had a vacation or anything to speak of. So I said, I'm just walking away for a while to get my bearings. And I happened to, during that period of time, I'd say after a month or two, realize that making a living was also important. And a friend of mine showed me an advertisement in the classified section of the San Francisco Chronicle for a licensed physician needed to staff an acupuncture clinic in Los Angeles. And at that point, this was in 1973, I believe, I knew nothing about acupuncture. I knew the word acupuncture, and it was a little reverb
That
there.
was me. Yeah, I'm sorry. It started playing on the Facebook simultaneously.
Oh.
I was looking for the comments in case there were questions.
Yeah, so this was actually a setup by a retired obstetrician gynecologist in Southern California who hired some Korean acupuncturists to set up clinics in Southern California, but legally they weren't allowed to treat patients. So he needed licensed physicians to staff these clinics. And so he put this ad in the Chronicle. And I looked at it and I said, well, you know, I don't know what acupuncture is, but it's not what I've been doing. I know that. Plus, I had some friends in Southern California that I'd like to visit. So I said, okay, I'll go for that. And it turned out it was a 2-week training course with the Korean acupuncturists as teachers through translators. And I was exposed to a whole new world where poetry was part of reality. That's not true of Western medicine.
Yeah.
Art was part of it.
In 2 weeks, you got all of that. That's amazing.
Well, I got the sense. I got the sense.
The taste of it. Yeah.
The taste, exactly. That's where they were coming from, that there was a whole nother way of looking at the practice of being a healthcare provider than I had had 7 years of intense training in, 8 really with my internship. So I kind of got hooked at the idea, but part of that process also involved, after the 2 weeks, me going into the clinic. And because the Koreans were not allowed to treat patients, they couldn't even be in the room with them. They could only look through the window. So I had to do the examination and the history, and then come out of the room and through a translator tell the Korean practitioner what the story was with the patient. They would draw a stick figure of a human being and say, put the needles here, 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 and here. Wow. I'd go back in and do that. I thought, this is totally insane. You know, there's no way that this is going to make anybody better. But, you know, amazingly enough, people start migraine headaches and arthritis. They started telling me, you know, this is really working. I feel better. And
can I ask a little into this?
Yeah, I had no way of really placing that in my concept of what the world was about. But what I knew was it meant, since I had had so many years as a student, it meant, why don't you find out everything you can about acupuncture, which in 1973 was easy. There were like 3 books about acupuncture in English. So, you know, in the space of a week, you could know everything there was. And so that was my intro to acupuncture, and it was Korean style. It was, you know, not something that's very well known in the United States these days, although it is still practiced in America. It's one of the minor styles of acupuncture. And it was only, and then I found one of my teachers from this group of Koreans to become my mentor, and did a 10-year preceptorship with him where we opened the practice together, and also spent with a colleague of mine, Stuart Cutchins, that you may have heard of. We spent every week for over a year in class with him, learning acupuncture as a apprenticeship system where he trained us basically, and then we worked together with him in clinic. So I had all of that.
Can you give a time frame? What was those 10 years? Because somewhere in there, was he a physician? Did he get a chance to actually, was he able to do needling and show you how to do that? Or was this in the transition when the legalities were shifting a bit?
Yes, he as soon as the legalities opened up under Governor Jerry Brown's first administration, acupuncture was legalized for non-physicians, and he was one of the early licensees. So he was able to practice. And this was, from the mid 1970s to the mid 80s, we pretty much spent every week together. So it was a quite intense experience for me. He's passed on now, and I really owe him a lot. And it's another of the ancestors I want to honor. But I realized that during that, even during that 10-year process, that there was a limit to how much I could learn from him because of both language barriers. He wasn't perfectly fluent in English, and because his experience was a Korean experience. And I realized from my readings that there was much more to acupuncture than the Korean version of it. So I happened to be in San Francisco at a time when JR was giving a public speech, and decided to go hear what he had to say, and of course was entranced by it, and ended up signing up with Haig Ignatius at that time to go over to England for one of the early classes that JR started for Americans. Wow. And so I got training through the master's level in England. And so I was trained both in the original Korean style and in the 5-element Worsley style. And then very early on, I had an opportunity to go to China to study, because if you weren't around then, but in the early days, there was a lot of bad feeling and distrust between the 5-element practitioners and the TCM practitioners. They barely spoke to each other. And one of the early things I did was to go to China to try to find out what TCM was about, because in the very early days, there was nothing available about TCM. And so I took a class in Kunming originally in China. And when I came back, all of the 5-element practitioners in the San Francisco Bay Area, of which there were quite a number, were asking me, "What did you learn? What did you learn? Can you share it with us?" So they set up a 3-day workshop, which turned out to be the basis of Closing the Circle. That was a 3-day workshop that I conducted.
You guys know this work, Closing the Circle? If you don't, please, at some point, if you are anywhere around the practice of acupuncture and have any interest in sort of where the various traditions kind of are, this is, I think, a crucial piece of work that gets left, not everybody gets access to, so.
Yeah, it's out of print now, but again, if you write me, it's possible to get, I can go over to Kinko's and Xerox off a copy of it. So I shared that 3-day workshop with Stuart Cutchins, because I hate speaking for 3 days constantly all the time. But it was a wonderful experience. It really kind of exploded the myth that there was a right way to practice acupuncture, and that there was the correct group and the incorrect group. And so from there, I had my initial entry into Chinese acupuncture to add to the Korean and the English training I had. And through my Korean mentor, I got introduced to the leaders of Korean acupuncture, who the real masters, the founder of Korean hand acupuncture, for whom I sponsored classes and edited his textbook in English, and the founder of Korean constitutional acupuncture, who allowed me and Stuart Cutchins to be the, as far as I know, the only English-speaking observers to ever spend time in his clinic as attendees to observe his practice and figure out, what it was all about. He's in his late 90s now and just retired in the last few years. A real master.
In California or?
No, he's in Korea.
In Korea, gotcha.
Yeah, so And so what I've done in my own practice actually is to to integrate all of the various approaches to acupuncture that I've come across. I've had to draw some boundaries for myself. One of them that probably is the most important for people to know about is I realized that I could not become as proficient at herbal medicine if I put as much energy into mastering acupuncture as I wanted to. And so I'm not really an herbalist. And I don't want to mislead anybody into thinking that I have any expertise to offer about Chinese herbal medicine.
I think it's an interesting question to bring up right now because I'm not an herbalist either. I happen to, because my dad. So his thing was don't get too caught in the theory, right? Stay learning to observe, pay attention, let the patients teach you how to treat them, via pulse and the inspections. And so one of the things that I did to distract my mind while I was in school, I had small children, was I studied lots of homeopathy and Western herbal medicine. And also they were designing the Western herb program with Simon Mills at that time. So it was a good chance for me to kind of be distracting my mind without complicating my acupuncture practice because they were totally separate systems. So now I have a little bit of, I understand flavors and I understand shapes and how things grow, but I've never studied Chinese herbs. And so I don't actually know that world either. And it's interesting because at the moment it's pretty uncommon for people to only do one or the other, which I think wasn't always the case, at least in the US, wasn't always the case. And I think, for some of you who don't know, I actually do remember in that sort of funny time in those very early days where there was sort of the 5-element practitioners and the other TCM practitioners and the sort of idea that there was a right and a wrong way to do things. And it was actually reading In the Footsteps of the Yellow Emperor that helped me kind of understand where some of the breakdowns had happened. I personally love history as a lens into how we, change our social lenses essentially. So this is fascinating. And I'm so grateful to be able to talk with you and have you sharing all of your various traditions and wisdom and practice and where you are with us now.
No, sure. I love sharing what I know. And, for me, I even feel funny saying what I know. I'd rather say what I've experienced.
Yeah.
And my process is that obviously the reality of the world is infinite. There's no way that anybody will ever know everything. And so being a human being, we're always learning. And that's what makes life so exciting is that, it's not going to get boring because you're never finished with the process of learning. And so I've had many, many questions come up for me in my practice over 45 years. And one of the biggest ones has been, I am just personally not very good at the 5-element color, sound, odor, emotion diagnostic process. I wasn't 20 years ago, and I'm not much better today at it. And yet I can see and have experienced how powerful and valuable it is. And so a big question for me is there any other way that it's possible to get to a diagnosis of somebody's constitutional makeup, which JR called the CF, I call their constitution, other people call the guiding element. So there are lots of different names for it, but basically it's all the same thing, I think. And what I've come to is the realization that from the earliest classics of Chinese medicine, there were two things that were emphasized as the most important parts of diagnosis. One was what they called complexion, which included color, basically. And the other
as I turn blue in the twilight.
The other was pulse. And um, what I realized was that in all of my early training in acupuncture, I had never come across a teacher who was very effective at communicating how to learn pulse diagnosis. You know, there are the standard Chinese descriptions of the 28 qualities. I was never able to find anyone who was consistently able to train people in recognizing them. And I've also actually read studies where they've looked at inter-rater reliability of how often do people agree with each other about what kind of pulse somebody has, and it's not very good.
No.
Yeah, but
That's
that,
interesting,
yeah,
actually.
it's very interesting. But when you realize that from the very beginning, the pulse was emphasized as one of the two most important aspects of diagnosis, I decided at that point that even though nobody had found it, nobody had written about it, there must be a marker in the pulse that corresponded to somebody's constitution. And so early on, I actually had a discussion online with Jack Daniel about this question. And, his response was, yeah, I've tried to look for that too, but, it doesn't line up, the things that are, standard, like wood has a stringy pulse or that kind of thing. That's not at the constitutional level. And so you use it. So what I did is I basically decided I am going to look at every ethnic approach to acupuncture, the Chinese, the Japanese, the Korean, and I also found that I needed to add the Indian, the Ayurvedic, because they also use pulse diagnosis. Yeah. And
this is where the 2015 book came in?
Yes, so this is what led to the next book, which is this one here called The Complete Acupuncturist.
You guys see that?
I don't know if it's facing forward or not, but that was the one that was my first book with Singing Dragon Press, and is basically where I shared with the public what I had come to as what I call the Rosetta Stone, that allows you to transpose pulse findings from one style of acupuncture diagnosis ethnically to any of the others. So I can transpose what an Ayurvedic pulse means in terms of 5 elements, or in terms of Chinese 6 meridian diagnoses, etc. And so that's been my life work for the last decade, really, at this point, is developing and expanding the use of the pulse as the way to understand what's happening with people, and realizing that it exists at 2 levels. One is the normal level that, for instance, TCM uses, which is what's going on now. What is the state of this patient? And that is revealed in the pulse. But the other is, who is the person that this is happening to, which is the constitution. And that's also revealed in a different layer of the pulse. Yeah. And by discovering how to identify both of those at each moment in a patient, you have a much more powerful and expanded ability to figure out treatments that are aimed at what I call bringing people back to themselves, because your constitution, as revealed in its pulse, is who you are. It's who you were created with. It doesn't change throughout your life. It's always the same. But when you have a condition, which is this present moment state, you've departed from your original nature to some degree. And the best treatment is the one that helps return you to your constitutional state. And so that's what I spend my time thinking about, studying, and trying to advance with all the techniques that are possible. I think it doesn't matter whether it's Chinese, Korean, or anything else. They all can be used through that giant lens, and all the subparts are just smaller lenses for looking at the whole picture through each of the lenses.
It's so fascinating to me as you're talking about. I'm wondering, I notice I have two questions that I kind of keep getting a little hooked into, which is one of which is um, all of the traditions. Are there any traditions in which either there is no concept of CF or constitution, or where it's mutable in some way, or there's a I'm wondering if you bumped into that along the way ever, or if there's some, yeah. So I'm curious about that and how you look at that in the context of others, which I know, right? Some have 3, some have 5, some have 6, 12, whatever, and they're all different kind of layers. So I'm curious about that piece of it too. But are
Yeah.
there any that just don't do it at all?
I think I'm not as knowledgeable as I would like to be about the Japanese tradition to know whether it started with that, but the closest I could come is in the meridian therapy style of Japanese acupuncture. They very much do treat on a 5-element basis, and the originators of the meridian therapy tradition, I think, had in mind the idea of constitution, although they didn't use those words to talk about it. But it looked to me like their original approach was based on always treating patients from the same diagnosis as a constitutional basis, like somebody is a weak liver type person, which would be a wood constitution. However, the more recent offshoots of meridian therapy, I've seen lots of practitioners talk about people changing the diagnosis such that, for instance, a weak liver person could on another visit show up as a weak spleen person. So whether it's truly constitutional or not, that becomes a messy question. But I think at heart, one of the wonderful things about the Worsley tradition is that it made it very clear that its basis was that everyone has an inherent element that is important to identify for treating them, which he called the CF as causative factor. I don't want to misstate his nomenclature, although I do believe it's the same as constitution. He did not say that.
Yeah.
So
I understand too. His way of looking at that evolved over time as well.
yes, yeah. And the only other style that I think from the outset made an equally important emphasis on constitution was the Korean constitutional style that I mentioned, this 95-plus-year-old teacher of mine who invented this style. And that has been a very, very big part of my own practice, because that was how I realized that it wasn't just the English version of acupuncture that recognized the Constitution, but that was really built into Asian concepts. It just wasn't always explicit, and it needed somebody to recognize it needed to be talked about. And interestingly enough, this Korean teacher of mine, Gwan Do-an, discovered his way into that also through the pulse. But again, he takes the pulse not in the way we're taught. I'm not sure how to do this so that people can see it. Not in the standard Sun Guan Chi first 3-finger position, but further proximally on the arm in positions that I would call 4, 5, and 6. And he identified a pulse pattern at that site that never changed throughout an individual's life, which again
That's
means
like a
de
more
facto it must be
constitutional.
constitutional because it doesn't change whether they're healthy, sick, old, young. So it verified that there really is a biological message that we all carry that involves our constitution.
Mm, so interesting. It's not for me, even though I'm sort of, in theory, I'm a five element practitioner because that was sort of my underpinning. I often think of myself as more practical or observational. Sort of of this confluence of influences. But you know, my father at the end of his life, at least, and I don't know, you know, what point along the way you guys were interfacing as teachers with Worsley, et cetera. Um, and you know, my mother wrote this five element book, and it was interesting as you were talking about constitution is like coming back home to oneself, and that was her second book, was All Sickness is Homesickness. And I can feel that in my sort of self, that makes sense, right? There's a place where we can come home to ourselves. And in practice, you know, I have found over the years from in my private practice of acupuncture that some people I treat in one place. I've never sort of subscribed to I only treat in one element if that's the person sort of if I see them as that kind of a person. I don't kind of hold that. I tend to think more like maybe you're a pasta dish and maybe you're more like a, you know, maybe you're more, you've got more noodles and maybe you've got more spices or something like that. Um, and like, where's the place where I see, sometimes I see more happening or sometimes I see less happening. Like what shows up as missing is often a place where I'll start with someone and get curious about it and see if I can kind of play in that space with them. Um, and yet I'm also interested in sort of the interpersonal piece of, you know, having watched somebody that I thought I knew sort of really like, okay, this is a really earthy person. They sing all the time and they've got this thing about them. And then have somebody else come in the room and suddenly they're pink and they're laughing and I suddenly think, wait, who is this person? Do I know this person? Is this even the same person? Um, it's just always been such an interesting thing for me to watch my own ideas about who people are, what's possible in terms of change for each of us. And I'm interested in it because I notice that, especially now, right now, I've been talking with lots of practitioners who are wondering, I can't feel pulse. I can't use needles in this moment, or those of us who are in lockdown versions. Um, and what does that mean? What can I do? Who can I be with people? And is there a practice for me to have? So I'm curious also about sort of like, who are we together? What's a practice? What does your practice right now look like? I mean, I know.
Well, so I'm also on lockdown. So, you know, that's really hard for me because that's the light of my life is working, you know, even though I'm 75, I look forward to going to work every day
Yeah.
full time. Um, so it is hard. But one of the things that actually happened early in the corona epidemic was I trying to remember how did I come across this. There was a post on one of the groups that I'm a member of on the internet that was from a doctor who had treated patients in the SARS epidemic in, what was it, 2003, somewhere around then. And he said he had a family secret tradition that involved putting sesame oil in the nasal cavity. And he used this on himself and never got sick, and that it was some sort of secret family thing that got me interested in thinking about it. And because I had also studied Ayurvedic medicine, in which sesame oil in the nose is a very common intervention. It's used for stabilizing vata.
Oh, that
So
makes
I
sense.
had those two things clashed together in my mind, together with my Western medicine hat, which was seeing right away that people who get coronavirus infections, not just this COVID-19, but the whole family of coronaviruses, basically attack the respiratory system. And they start out in the upper respiratory system, and the real serious cases are the ones that progress to the lower respiratory system, which is the lungs, basically. And so it occurred to me that if it was possible to do something to interfere with the ability of the virus to get into the upper respiratory system, it might be possible just to shut down the process so that they'd never get to the lower respiratory system. And I thought that might be the reason why the sesame oil in the nose approach could work, not because it had anything to do with killing viruses, or any of the other Western ways of thinking about how medicines and such approaches work, but rather it was simply a physical barrier that, because of its physical properties, it would cover up essentially the receptors that the virus needed to attach to penetrate deeper into the body. And so I started doing it to myself, using a Q-tip soaked in sesame oil up my nose every day, every morning, and just started advising all of my patients to do the same thing. This was while I was still working before the lockdown. And I'm happy to, at least at this point, say that even though I'm no longer seeing patients right now because I'm not supposed to, none of my patients have had any symptoms, nor have any of them that have been fortunate enough to get tests tested positive for the coronavirus. So I posted this on the Scholars of Chinese Medicine website and my own personal website. And it's gotten over 100 likes and probably over a dozen shares. It's gone around the world. It's been shared in Europe and other places. And just this morning, I had a share from a Native American healer who comes from a family of medicine men, is how he described it himself, saying he thought this was the most significant recommendation for how to protect yourself from the COVID-19 virus that he'd come across, because one, it's very cheap, very inexpensive. So even the poor Native American people who are, socioeconomically deprived, they can afford some sesame oil and a Q-tip, which is, not a big deal, not expensive. And, whether it helps or not, I don't know. I'm not going to make any claims that this prevents anything.
Yeah. I was going to say, we should probably make our little disclaimer so that we don't get kicked off of Facebook or whatever, but
exactly. But there's no
what? I think this is a great moment for this kind of, this isn't going to be double-blind, placebo-controlled studies, but this is a great moment, I think, for lots of, grandparent wisdom or whatever, or traditional wisdom, depending on, what you want to call it, to, get a chance to at least see, is it useful and how is it useful? And it's, as you're talking about, I realize there's a study that has just come out about this, the idea that the sense of smell is lost is one of the symptoms. And they were talking about that it may be related to the receptor, there being a certain receptor that it latches onto in the nasal cavity. And so it's like, for me, it's always so fascinating when we finally have 100-year-old science that starts to prove 5,000-year-old science.
Exactly.
Right. And it's sort of my little giggle is to find my colleagues, and I love you guys, but to find them sharing, the science proves that things that people have been telling you for 5,000 years are true. And it's such for me, it's kind of fascinating just to watch the sociology of why we need the new science to prove the old science. But I'm so grateful that, that also that you have enough wherewithal to be all over the internet, so that you've shared your what you think might be useful, that other people have taken it and shared it around. It is, and I think a lot of people don't quite get that this is an important piece of something at a global scale like this. It's got to be simple. It's got to be accessible, affordable, and it's got to be something that doesn't have so many contraindications that, or supply chain issues even.
It's very safe. It's been used for thousands of years in
Yeah.
Ayurvedic medicine. Yeah.
Yeah, so I think that that's an interesting piece. I had a little group of, colleagues who are a little closer to my generation in practice that, who are herbalists. And we were talking about what would be something useful that we could share with everybody. And what's amazing is we all kind of, those of us who've been in practice, right? We still come back to, you know, get more sleep.
Exactly. Yeah.
Move your body, do some breathing, open up your lungs. Like it's amazing how it's the simplest of the things and the safest of the things. Maybe do a little dry brushing, do some things that people have been talking about forever, but are often in the paradigm of um, give a medicine. We forget that there are actions that are medicines, that that produce our own endogenous medicines or our own ways of navigating something, which, it's one of the things I love about practicing acupuncture personally with needles. My dad always said, you'll always have something that people will always need some kind of health care. And you can trade it in a desert. All you need is a sharp stick. you can trade your wares in the desert for a cup of water or a piece of bread.
Yep. Yep.
And so it's one of the things I love about the simplicity of, because you then also are thinking in that realm of, oh, if we did this with the nose, because there's something about entryway,
Mhm.
like we don't have to get to the complexity always.
Yeah, and it's interesting that once I started doing this, I also did a literature search to see if there was anybody else looking at this issue, and came across a Chinese publication that looked at sesame oil in the nose from a solid material physics, material sciences basis
Uh-huh.
as to why it might provide a barrier explanation for preventing the virus from being able to penetrate. And I managed to finally actually make contact through a Chinese version of social media with the author of this article. And so we're now friends on WeChat, is the Chinese site.
Yeah.
And it's really wonderful. It's like a silver lining. And he lives in Wuhan, which is, that was the epicenter of where this.
Was he doing it himself too?
I didn't ask him if he's doing it himself. That's a good question. I could. He's not a doctor. He's a physicist. And was just looking at the material sciences properties of surface tension and miscibility and melting point, and all of these things about why sesame oil might have different properties from putting anything else in your nose, and might be the perfect thing that actually would work as blocking the receptors.
Does it have to be sesame oil, or could it be olive oil or coconut oil, or?
What I'm recommending to all of the people that I give advice to is stay with sesame oil, because that's the one that's been studied to have these physical properties. Again, it's not just that it's oil, it's that it has very specific surface tension, et cetera, properties that allow it to maintain the coating that might, and also might hold on to the virus in the oily layer that prevents it from getting to where the receptors are in the nasal mucosa. So I would say stay with it. But again, I want to be very clear about this, which you emphasized, and I agree with you 100%. I have no evidence to say that this process will protect you from getting infected.
Yeah, still wear a mask if you're going to be exposing yourself someplace.
Yeah. Please do not increase your risk. And don't use this instead of any of the other known ways and recommended ways of avoiding getting infected, which are the social distancing, wearing masks when you can. All of those are definitely what you should be doing, and washing your hands if you have any contact with anything that might have viruses having been deposited there. So all of that is certainly something you should be doing. And this can be added to it because it has no extra risk and it has a really big upside if it happens to turn out to be
Useful, yeah.
we won't know that maybe for a long time, but if it does, the upside is so big that I'm really excited about it because the
Yeah.
downside is almost nil.
Those of you who are watching, I actually would love if you would, because I think this could be a great time if we can get, and people won't remember after the fact exactly what they did on different days, but if you're taking supplements, this could be a great retrospective study on various things that you've done as interventions. And I think just to even call that kind of stuff later could be fantastic. I was thinking as you were talking like about sesame oil, and I thought for me, the smell of sesame oil too is got that sort of earthy kind of smell to it. Unlike you, I'm actually very sort of versed in color, sound, odor, emotion, and odor, especially for me, is one that my husband actually laughs at me because I smell everything. He says, "You're going to smell that, aren't you?" Yes, I don't. If I see something on the floor and I don't know what it is, I'll smell it before I'll pick it up. but yeah, I was just thinking sesame oil has that sort of, if we're thinking about congealed mucus and that kind of a thing, and that sesame might have some affinity for that kind of it smelling wise. I don't know. I'm playing with it as you're talking about it because that's what I like to do.
Sure, sure. And
Yeah.
none of this is hard factual knowledge. This is all what a living experience for all of us, and we're all trying to figure out how do we keep ourselves healthy, how do we keep our families healthy, how do we keep our friends and patients healthy.
Yeah.
So I really would appreciate it if anybody, I don't know if anybody except us two are here in this meeting, but
there
maybe.
are, let's see how many people watching now. I can't see how many people are watching now, but we've got 6 shares and it looks like maybe 20 or so people over the, yeah.
Yeah, great.
Yeah, some of my notes said they'll come later and watch the
yeah,
replay.
yeah. So even if in the future anybody does decide to try this out and has anything to say about what results they've seen in terms of, they've treated themselves and their family and so many patients, and yes, they have had a case of somebody coming down with the infection, or no, if after we've passed this epidemic, fortunately none of my contacts that did this got the infection. That would be really helpful to know, because again, we don't have an easy way to study this. We can't do not even close to double-blind studies with this. So we're just grasping at knowledge here.
Yeah. What do you, I know you, pulses are your, at least I know that a lot of people know you for pulse and your wisdom around pulse diagnosis and teaching. Is that what you're like, of all the things that are fascinating you in this moment in time, is that what's got you kind of most enthralled still, or do you have you moved on to new things? I mean, besides sesame oil, I don't know.
Yes, I'm still enthralled with pulses, and that's the biggest frustration of being locked in my house, that I can't feel my patients' pulses. I have a number of patients who are cancer patients that I've been able to turn around their pulse patterns and actually see regression of their tumors concomitant with that. Although most of my patients also get Western medicine, so I never ask them to choose between the two. So they do both together. But I've had their oncologists tell them when they ask, should I keep doing my chemotherapy? The oncologist says, well, to tell you the truth, you're not supposed to be around here. People usually don't live this long with what you're doing. So keep doing the chemotherapy, but keep doing whatever else you're doing.
What do you tell them? I mean, what do you have them do something at home? Is there something that they do at home now when you can't see them?
No, the only thing that I do in addition to acupuncture treatment, as the skills I have, is some dietary advice that relates to their constitution, constitutional theory. The other thing
is it kind of from a five element or Chinese dietary?
No, it's from the
Which lens do you use for that?
yeah, it's the Korean constitutional lens.
Yeah, gotcha.
Yeah. So the other thing that I did want to make sure I included just a little bit is that for me, um, over the whole course of my career, the adage, the proof of the pudding is in the eating, has always been in the front of my mind, which is I care more about showing the results in practice than I do about the theory. And so I've had the great fortune of the last 3 years having been invited to China as a practicing physician to treat patients there in a situation where they come back day after day. I do 5-day workshops where the patients that I treat come back every day to report on, are they doing better, are they worse, or are they still the same? And I've had wonderful, wonderful feedback. And this is, again, using my pulse-guided method of treatment. But it's been wonderful getting that kind of feedback that this is not just theoretical mind games, but it's actual lived clinical reality, including one patient that in my last visit to China, that came complaining about knee pain, that when I was examining her, I said, I can't treat you for your knee pain because I have a very strong feeling that you have a type of tumor, a type of cancer, and that's really what needs to be treated. And she agreed and let me treat her. And only after that, she admitted to me that she had previously been told by her gynecologist that he very strongly suspected she had a cancer, and because of some of her lab values, and that he wanted her to follow up, and she had. But she responded very positively. Even her knee pain got better from the cancer treatment I gave her.
I was going to say, I know I agreed to let you go by 8, and here we are. Although I realize I have more questions, we could go on. So I just want to respect your time.
Yeah, it's up to you.
If you're open,
I'm at home for the next 2 months. I got nothing to do.
Me too. I didn't know if your dogs might have a schedule for you. Mine sometimes do.
Yeah, well, I have a wife who can take care of the dogs. So.
I was going to ask, because when you mentioned this about treating, when somebody comes in and they've got a symptom and that's the one they want you to treat. Mm-hmm. And you can feel from checking in with them that there's something else going on. And you kind of have to make that call as the physician to say, I know this is what you're on about right now. My father's way of talking about it would sometimes be that your body is really wise. Like sometimes your knee is protecting you from moving into doing something else, or that your body is sort of compensating. And so from my way of thinking about it, of course, treating the issue of the human being, the most important thing for the human, which is the tumor in this case, would resolve some of the pain in the knee, because of course it's all interrelated. So just curious, how do you think about, do your patients come in and say, here's the problem, and you say, well, okay, we'll deal with that problem? Or, I'm thinking about the interrelationship between constitution and symptomatology, and sort of how do you think about your way into that conversation?
Yeah, so I never know in advance how I'm going to approach treating anybody. So when they come in, obviously I do a TD on them, try to figure out, what am I faced with? What's going on here? And it can be all over the map. It could be, a simple sprained muscle to a mortal illness. It could be anywhere in between. And one of the hardest decisions for me is in this particular circumstance where I feel somebody has a really serious illness like a cancer that they don't know about. And what is my ethical obligation to say what I think is going on, even though I'm probably the only person in the world that has this particular skill that I believe can diagnose that, but it's a hypothesis of my own. I've verified it many, many times, dozens of times in my own practice. So I believe very strongly in it, but it's not something that I can document. The Western medical profession certainly would not accept it. And
Yeah.
I don't think anybody else in any other profession knows enough about it to be able to judge it. So I'm always in an ethical quandary. And this was a good example when this happened in China, when I told this woman that I thought her problem was a cancer and that I needed to treat that. The other um, people running my visit uh, who were sponsoring me got very upset. They say, "Oh, you know, even in the doctors in China don't tell patients they have cancer. They tell the family. You don't ever tell a patient that they have cancer, even if they have it, even if they have it based on an MRI scan where you know, or a biopsy. You still don't tell the patient. That's up to the family." And you know, I was in hot water for a couple of days when I did that because, you know, I mean, I didn't know. But as it turned out, A, because she got better with her symptoms, and B, because she then divulged that her other doctor had already told her the same thing, they turned around and said, "Oh, thank you, you did the right thing," you know. They turned out okay. But actually, yeah, actually, I've been in the same circumstance with several of my patients in California
Yeah,
where
what
I
do you do?
felt that, you know, I think there's a cancer going on. And what do I do? Do I say something? Do I not say something? I would say in the majority of the patients that I've treated where I've said something, the patients have been very grateful. They've gone to their, and I always tell them, go to your doctor and get
Yeah.
examined and, you know, from a Western evaluation and find out, you know, what's going on. And they have had tumors show up. So I've been correct about that. But they've been very, very grateful that I caught it so early, because when you
Yeah.
catch it early, even if they don't get acupuncture, just from a Western medical treatment standpoint, they're in much better shape for dealing with it. I've only had one patient so far where she actually did tell me she had a cancer that I confirmed by telling her, "Yes, I agree from your pulse. I think that's what it is," but was so freaked out by the type of treatment that I use for approaching cancer treatment, which is a pretty involved treatment. It's not a simple 2-needle treatment. That, you know, that didn't work out, and so she decided she would stay with just Western chemotherapy and Western style medicine, and that was fine. You know, that worked out okay. But like I say, the vast majority of patients, my feeling is they've been very, very grateful that I was willing to take this ethical stance of um, sharing my feelings about something that is really on the borderline of medical ethics. I don't even know where
No, it's a good
authorities will
question.
come down on
It's a
that.
good question. I was wondering from a constitutional factor kind of standpoint, I was wondering, are there certain kinds of constitutions that really don't want to know,
Mhm.
or might be really upset with you? I mean, I was sort of pondering that as you were talking that, um, I mean, and gratefully as an acupuncturist, you probably at least have some nice ways of knowing enough about a person to know how to talk to them about it in a way that actually can land, which is so different from where you started with, Western medicine training, where you get out and there's so much hierarchy that you're now but it's tricky because it's still a little bit of a place where suddenly are you the expert of their body or they're the expert, right? And that's it's the place where where you're having to keep kind of finding that line of partnership with them, really.
Yeah, yeah.
Yeah.
Yeah, but I think what it comes down to for me is if I think I have a chance to save their life,
Sure.
even if it makes them uncomfortable, I
Yeah.
have to at least give them the opportunity to choose that.
Yeah.
You know, I still will respect their choice if they say, "No, that's not the path I want to go down," and, you know,
Yeah.
please don't pursue it. I'm fine with that. But I think I'd feel really bad if I kept my mouth shut and just let nature take its course.
Yeah, for sure. What beautiful. Thank you for so much for being willing to share. I know that we, I'm sure that I'm not the only one who has come across moments where I've thought is there something else going on here? And if so, is it my place? When is it my place, or is it my place to ask you to do something else, or to step in a line where, for me, it shows up often with children, or with expectant mothers or something like that, where, it's like, it's actually my ethical duty, feels like, to say what I see showing up here, if it's something that could really make a huge difference, and the difference between life and death, or difference between surgery or no surgery, or whatever it is.
Well, I think that if you've established that real solid relationship with your patients where they know you really love them and care for them, that it's much easier to, no matter what your choice is, it's much easier to deal with the situation than if you're just treating it as a cold clinical, going to see the dermatologist. He does shines a light on your skin and says, whoops, you have this kind of basal cell cancer here, we got to take it off. I mean, that goes from 0 to 100 miles an hour in the space of seconds. And that never feels comfortable. I think it really, having that relationship first of trust and respect for each other is really crucial.
Yeah. And then there's also, I think, for maybe, I don't know about for you, but this fuzzy line for me sometimes between, this feels strange, something's up. And for you, it's probably even more nuanced, to the level of, like, this is a proclivity to create cancer cells. It's like, almost like you can feel that. And like, where's the line between that, knowing there's an actual formation of some kind, knowing that it's at a stage where it does need some Western treatment and intervention, because, as we learn more and more about cancers from the Western medical perspective, we understand that bodies will create little cancerous sort of clusters and then heal them, quite often. But then the question is, right, if you're so nuanced in your pulse reading that you can sort of taste it early, then, how do you think about when do you say, well, let's see if we can turn this the other direction together, and when do you say, okay, it's time, this is clearly something that's amassed.
Mm-hmm.
Yeah. I don't know if you have guidance on that. I was just sort of pondering it out loud with you as I was thinking about
it. My procedure is, if I clearly feel that there is a tendency towards a cancerous process going on, unless I have some reason not to pursue it, my inclination is to begin treating fairly soon. But often what I will do, if it feels like it's really early, in that there's been no symptoms, and none of their other doctors have been worried about them, is I will encourage them to go get a baseline Western medical total evaluation before I do any kind of acupuncture treatment with them, just so we know where we're starting from. Yeah. And then, even if it is very early in the process, I will start using the anti-cancer protocol for that person, and it's different for each constitution.
I was gonna say, we probably it would take us a week to go into that conversation, wouldn't it?
Yes, yeah. It's not a one size fits all approach. Yeah. So, but that's led me to recognize other things that I'm investigating, including chronic infections. I think also have a particular signature in the pulse, and I'm thinking even neurological problems have a signature in the pulse. But that's partly why it's so frustrating to be kept at home and I can't get to people's pulses to check on them. But it's a lot. I'm still looking forward to doing more research and hopefully training other people in the things that I've been working on. I have classes in Spain that I've been conducting, and as I said, in China, and
Yeah.
I've done some other.
Are those things that people can sign up for? I mean,
Yes,
they're through your website kind of thing, or I mean, I know everything's kind of on hold at the moment, but
yeah. No,
yeah,
it hasn't been through my website. My whole career, including the teaching I've done at MUIH and TIA, has always been by somebody requesting me to have a class. I've never
yeah,
established a class by myself.
yeah,
So, I'm happy to share what I know, but I'm a terrible business person and organizer. So somebody does that for me and I show up. That's the way it
you have
works.
one person who does that for you, or you mean just in different places?
Anybody can do that who wants to. I have one person that does that in Spain. I have one person that does that in China. Those are the two principal people, but they have
Places.
their assistants or collaborators that they work
Yeah,
with.
gotcha.
And I have some requests from other places, people in France that have asked me, will I do this, and a possibility in Greece. So, there are other places this may happen. But
Yeah,
again, it's not through me, it's through them.
through them. Yeah, gotcha. Okay, well, so we'll have to come seek you out in the other parts of the globe when we're all free to move about the world again.
Sure. And
Yeah,
what I like to do is on my own website, it's not a closed Facebook site, it's just Peter Eckman. I always announce anything that I have planned to do. So if people want to, just follow my website, which I don't post very often, but occasionally, if I am going to be teaching, I will post it there. And so the details will be available for people that want to contact the host at that point.
yeah, good. I was going to say, so I said I would keep track of questions, and there are just a couple of things, just some comments and some questions.
Okay.
Um, and Rabab, I may need you to clarify a little bit because you have a couple of questions in here. I want to know, as long as a practitioner can hold the possibility of healing. Some thank yous. Thank you from Samantha for someone to address that question, although I don't know which question now because it's been a little ways. Oh, I think it was about how to hold if you found a pulse that feels cancerous or something, and whether or not to speak to it and how. And so this one could probably be a whole week's worth. I'm sure this is kind of what you're doing in some of your other courses, but is there, from Jody, we've got a question. After all of your pulse study, do you have any nuggets of wisdom about listening to the pulses? Anything that's deliverable with it, within reason over Zoom.
Yeah, I don't think I can give you a directly clinical pearl in terms of this pulse means that. But what I can say is that the whole gestalt of how you approach pulse diagnosis needs to be enlarged. That all of us start out learning from the school or the teachers we've had a specific method of examining pulses, and that's how we think of pulse diagnosis. But actually, there are many different techniques and styles of pulse diagnosis that are components. They're like different lenses, as you mentioned before, of looking at things. And so if you can relax a little bit your concept of what pulse diagnosis even is, so that it can include a lot more than what you're already doing. It's not so much that you have to be better at what you're already doing, it's that you might have to try doing different things than you're doing, like moving your fingers to different places. Actually, the earliest description of pulse diagnosis in the Chinese classics is looking at the relationship between the carotid pulse and the radial pulse. It has nothing to do with the things that we learn about, the wrist pulses per se. It's about the relationship between the neck and the wrist. So, and that's part of what I do on every patient.
Sorry, it leads me to sort of another piece of it. So when I think about how I think about pulses at large, Because I know that for myself, my pulse, it's a pretty intimate thing that's very hard to describe to other people, right? It's a long process. But I think that what I'm often doing is I'm having a bit of a conversation with each of the pulses. And so that's the sort of, you know, gestalt or whatever it would be, whatever have you, about how I think about. I'm approaching a conversation with some of the internal players of this person in front of me. Do you have like a one framework that you hold in some way that is sort of how you approach, right? Because I don't think we can get into pulse diagnosis here, but the just like, what is your, how do you hold what it is you're doing when you're feeling pulses at all?
Okay, so two comments. One is, I think what you described as the way you approach it is the classic way that I learned in the Worsley School. That's a very good description of what I took away from JR's teachings. What I do personally myself is I look at it as a stacked series of lenses, that there are maybe 6 or 8 different ways of examining the pulse that give me information, and I need for both the Constitution and the present condition to get at least 2 different lenses to give me the same diagnosis, the same feedback, for me to have confidence that what I'm feeling is correct. That if I don't get that, if they disagree, then I think I'm making a mistake and I have to go back and redo the pulses. And so I build up a picture layer by layer by layer by layer until I get to a place where everything tells me the same story. And once I get that, then I know, maybe this is answering your earlier question, how do I know what to do? Is after I've done all of that, then I have the whole story, then I know what to do. But if I only have one part of it, it's, you know, it's like all the blind men and the elephant. You know, I'm feeling one thing or another, but that doesn't tell me what to do.
Yeah, yeah, yeah. That makes perfect sense. Almost like having a different, like having different languages and actually listening for things in different languages
Yes, great.
before you come to some understanding of what the real meaning is, or
Yeah,
something like
that's
that.
a very good analogy. And then the last thing I'd say about that is, in the workshops that I do, one of the main parts of it is not, I already described that I see patients as a doctor and I give lectures on the didactic material to the participants, but I also give hands-on feedback to all the participants on the pulse. I have them take their pulses on each other, and I take the pulses of all of the people that are in the class, and I give them feedback until they get the same answers as I'm getting, so that they actually learn practical skills.
Uh-huh.
That's my way of trying to teach this stuff.
Interesting. Well, so then so there's one last question here, and then I promise I'll let you go in case you want to eat dinner or something.
Okay.
Oh,
Okay.
that's maybe a little early there. Um, and it's kind of an interesting question to me. I don't see how it's possible, but Karen asks, she's been reading about the ability to transcribe a pulse printout to determine or ascertain what's going on with a patient. And that's in reference to telemedicine. Do you have thoughts about that?
Well, first off, I've never used.
Who is reading them and transcribing them? I'm so fascinated with even the idea. Is this a machine that reads pulses? Is that what happens?
Are you asking me, or are you
I
asking?
know, I'm sort of asking Karen because I don't actually know what this technology could even mean. How would you even transcribe a pulse? We'd have to have a taker of pulses in order to transcribe it, yeah? Yeah. Karen, I don't know if we can answer this question actually, because we need to know who is the person feeling the pulse that they are then transcribing. Would have to be part of the question, I think.
Yeah,
Yeah.
I have my own way of keeping notes on my patients' pulses. So
Yeah.
you know, everybody invents their own system of note taking.
Transcriptions, yeah.
Follow
Yeah,
their.
I think she must be referring to a machine of some kind. I'm not sure. Curious. Well, Peter, this has been fantastically rich, and I'm so grateful for you sharing your wisdom and your ancestors, acknowledging your traditions and ancestors and teaching us via where you've come from and how you've come to where you are, and then sharing what you said, not what you know about it. What was the word you used?
Experienced.
What you've experienced thus far. So I'm truly, truly grateful for your experience and for your sharing of your experience with us. And I'm aware, ooh, here we go again. I'm aware that you began with acknowledgement. And I'm feeling such gratitude for you right now, and for your contributions at large, and for your willingness to be here right now. And in this moment of interesting, right, from my from my little, 5-element place of like, we are in a moment of lung acknowledgement in the world. And here you began with some acknowledgement of those who've come before us and their wisdom. And I'm grateful for you as an elder, teaching us and sharing with us. So thank you very, very much.
It's been my pleasure. Thank you.
Yeah.
Love to your mom, and we can
Yes,
do it again sometime. It doesn't have to be this is it. We're finished.
Oh no! I think yes. If anybody would like more things, I'm happy to. We can keep chatting in public for forever.
Okay.
Right. Thank you. Have a good night.
Ciao,
Thanks,
everybody.
everybody.